Hello, my name is Claire Wynn, and my presentation is over Parkinson's disease. Let's get started. Parkinson's is a brain disorder. It leads to shaking, stiffness, and difficulty walking. People generally get worse and cannot walk or talk eventually. Parkinson's typically starts out gradually and then gets worse over time. It is a nerve cell damage that leads to brain and not producing the correct amount of dopamine. It can start with a simple tremor. There is no cure for Parkinson's, but symptoms can be treated with medication. Parkinson's usually affects people 60 and older. Rarely do you see it in young adults. There are almost 60,000 people diagnosed with Parkinson's each year. There is an estimated 10 million people living with Parkinson's. Dr. James Parkinson discovered his version of the shaking palsy, which is named after him. Constipation, impaired sense of smell, and dream enactment can occur before the motor symptoms of Parkinson's. There are 5 stages of Parkinson's. Stage 1, mild symptoms that do not interfere with daily activities. These can be changes to posture, walking, and facial expressions. Stage 2, the symptoms worsen, occur on both sides of the body. Daily tasks are difficult to complete and take much longer, but they're able to still live alone. Stage 3 is your mid-stage. You often have a loss of balance and slowness of movement. Falls are common in stage 3. Symptoms can impair daily activities such as dressing and eating. Stage 4, symptoms become severe. Likely the person requires a walker. They're unable to live alone. They can stand without help, but daily activities are extremely difficult. In stage 5, person may be experiencing hallucinations and delusions. They're typically bedridden and in a wheelchair. Around-the-clock nursing is required. Parkinson's is extremely hard on both the patient along with loved ones and caretakers. It can be so scary watching your loved one or yourself deteriorate. Caretakers often feel isolated and confused about the disease. It can be long-term and can progress slowly. It is a harsh disease and often leads to death. Parkinson's can lead to financial trouble and emotional turmoil. A caretaker will be required to provide assistance with daily basic activities, such as managing medications and scheduling appointments. It can be difficult to cope with the diagnosis for both the patient and the caretaker. It is important to be in daily physical therapy either at home or in an office to help maintain the symptoms. It is a long process to do daily activities due to slowness in the patient's movement. In the late stages, freezing episodes are common, which can lead to falls, so it is important the caretaker is able to lift and assist when needed. Dementia is common, and it is hard to speak to a Parkinson's patient who is confused and unable to think properly. Extremely close watch will need to be on the patients in the late stage of Parkinson's. It is important that a caretaker take time for themselves and take time away from the patient to recharge themselves and maintain communication with others. It can become stressful to be around the disease 24/7, although sometimes this isn't an option for someone who has no additional assistance. I interviewed Amber Humphreys for my Parkinson's interview. She assisted in running an in-home care agency and was the caretaker for her grandpa who was diagnosed with Parkinson's. The interview was very eye-opening for me. Amber opened my eyes to the difficulties family and caretakers face along with the fate of the patient. Amber assisted in signing new clients in the agency she worked in and matching a caregiver for their needs. She was allowed to meet with many patients that had Parkinson's. And then in 2016, her grandpa was diagnosed with Parkinson's. And then he was later diagnosed with Parkinson's dementia. She was the one that her family turned to help find care for him since she had the experience. Amber believes the hardest part of Parkinson's is the unknown. She said, "You don't know if it will progress quickly or slowly. You also don't know how the patient will react to it." Her grandpa's Parkinson's progressed quickly and he didn't manage well with it. They didn't have much time to say goodbye or to accept his diagnosis. However, she has seen some patients that were diagnosed a long time and managed well. I asked Amber what she feels most people are uneducated about when dealing with Parkinson's. She believes people do not know much about the non-movement symptoms. This includes the mental aspects such as depression, agitation, forgetfulness, even hallucinations, and dementia. She believes people often get confused between regular dementia and Parkinson's dementia. She believes there needs to be more resources out there for families and patients. She thinks there isn't enough resources for those struggling, and it is often hard to afford care. She would want to change getting assistance quicker for her grandpa. She wished she would have got more in-depth care. She feels as if her family put it off because he was adamant he was fine and did not need care. She thinks that physical therapy and other types of therapy would have benefited him greatly. I asked her what a silver lining or something positive came from having Parkinson's in her family. She said she feels she is more educated and that she can pass her knowledge on to others. She said if she had another loved one in the future diagnosed with it, she would be able to help them more. And she said Parkinson's is a terrible condition. She said watching her loved one lose their ability to do much, if anything at all, is awful. She said her grandpa was a retired chief in the Navy. He looked identical to Santa Claus, and he often used his retirement days to visit children's hospitals and veterans' hospitals to spread cheer as Santa. She said he was a wonderful human being, so to watch the light in his eyes slowly dwindle away was very hard to watch. I wanted to show you a few people who have had Parkinson's that you maybe didn't know about. The first one is Muhammad Ali. He was a famous boxer who was diagnosed in 1984. Unfortunately, he's lost his fight against Parkinson's in 2016. The next is George H.W. Bush. He was our 41st president of the United States and vice president under Ronald Reagan. He was diagnosed with vesicular Parkinsonism in 2012. He battled with it for several years before his death at the age of 94. Michael J. Fox, actor, most notably known for his role in Back to the Future, was diagnosed with early onset Parkinson's at the age of 29 in 1991. He has dedicated his life to Parkinson research and education. The next is Pastor Billy Graham, well known for his traveling church services. Well done, good and faithful servant. He dedicated his life to teaching others about the Word of God. He was diagnosed in 1993 and passed away in 2018 at the age of 99. Robin Williams had a form of Parkinson's known as Lewy body dementia, which is an abnormal deposit of a protein called alpha-synuclein in the brain. This affects the chemical balance in the brain, which can lead to problems with thinking and decline in function. This would have been detrimental to someone like Robin Williams, who was so entertaining and funny his entire life. His Parkinson's deeply affect his depression. Linda Ronstadt is famous for her impact on the folk rock and country rock scene. Admitted she had Parkinson's in 2012, but announced that it had affected her voice for many years prior to that. She's currently living with her disease. There is so many people that can be affected by Parkinson's, so many talented people who lose the ability to do something that had come to them so easily before. Parkinson's is truly an extensive disease. There's so many different symptoms, and not everybody has the same symptoms. Some have different ones. Some have all of them, some have one or two. Some of them can be a mask-like face, decreased blinking, degrading fine motor skills. It can affect your voice, just like it did for Linda. It can affect your posture movement, inability to stand up or straighten your back. It can cause tremors in your hands or your feet or your fine motor skills. You can have an inability to walk or move normally. It can cause repetitive muscle movements that make your bodies twist. You can have mental or behavioral issues such as depression, anxiety, fatigue, sleep problems, and cognitive abilities and personality changes. It can cause you to have aggression or sadness when you usually don't. It can affect your sense of smell. You can sweat more. You can have GI issues, urinary issues, weight loss, constipation, sexual concerns, just general pain. There's so many different areas of Parkinson's, and there's so many different types of Parkinson's. There are many symptoms of Parkinson's disease. There are also conditions other than Parkinson's that have many of the same symptoms mimicking Parkinson's. There's typically idiopathic Parkinson's, which is the most common form. However, there's other symptoms that suggest atypical Parkinsonism disorders, such as MSA, which has an average onset age of mid-50s. Symptoms include incoordination, abnormal blood pressure, and bladder function. Then there's PSP, most average form of atypical Parkinsonism. Average onset age is mid-60s. Symptoms often progress more rapidly. They include trouble swallowing, producing speech, and often sleep problems. CBS is the least common type of Parkinsonism. Symptoms typically start with one limb and move on from there. Typically, it begins after the age of 60, and Botox is a treatment that has worked for people with CBS. Lewy body is what Robin Williams had and includes memory loss and fluctuations in thinking. And then drug-induced Parkinsonism has been linked to any medication that can lead to the development of Parkinson, such as antipsychotics, antidepressants, calcium channel blockers, etc. And VP, which was what George H.W. Bush had, is multiple small strokes that can affect the brain, and it can be diagnosed from an MRI, and typically lower body issues are common with those. Thank you so much for looking at this presentation. I hope you enjoyed it, and I hope you learned something about Parkinson's disease.